starting with the sad fact that we're reporting an additional 15 deaths. 12 of the people who died are over the age of 65, and 7 of the people who died were over the age of 65 had underlying health conditions. The other 3 people who passed away were between the ages of 41 and 65, and 1 person had underlying health conditions. This brings the total number of deaths to 147 in LA County, and our mortality rate for COVID-19 has creeped up to 2.3%. To everyone who's facing a future without a person that they love, we are deeply sorry for your loss, and our thoughts and our prayers are with you every day. Today, we're also reporting 420 new cases. Over the last 48 hours in LA County, we've reported 1,083 new cases, and there are 6,360 total cases of positive COVID-19 in the county. These cases include 213 people who were reported as positive by our partners in the city of Long Beach, and 58 cases reported by the city of Pasadena, both which have independent city health departments. We're also confirming 12 cases amongst people experiencing homelessness. We are investigating 1 person who may have resided in a shelter while they were potentially infectious, and once we complete that investigation, we'll let you know. 11 of the other people who are experiencing homelessness were not in shelters. 78% of all our positive cases still occur among people who are between the ages of 18 and 65. And it's important to note that while many different people are infectious and ranges from young people all the way to very old people, disproportionately, people who are older and people who have underlying health conditions are at higher risk of serious illness and death. 1,366 people have at some point who are positive with COVID-19 been hospitalized, and that's 21% of all positive cases. Almost 2,000 people are currently hospitalized for COVID-19. No, that's wrong, sorry. We have about 900 people who are currently hospitalized for COVID-19, and this is much more than what we reported on Friday. 6% of people who are hospitalized are in the intensive care unit, and 45% of those who are in the intensive care unit are 65 years of age and older. 54% of people in the intensive care unit have underlying health conditions. You can see our updated report of LA County cases on the Department of Health's website at publichealth.lacounty.gov. I'm also want to update us on institutional settings where we're investigating cases of COVID-19. We currently are investigating cases of COVID-19 at 109 institutional settings. These are all settings where there's at least 1 confirmed positive case of COVID-19, and this includes nursing homes, assisted living facilities, shelters, treatment centers, supported living, and correctional facilities. The total number of confirmed cases in institutional settings is 512, and this includes both staff and residents. 257 of the confirmed cases are among residents, and 255 are among staff. And we're sad to report that among the people who have died, 26 people who have died were residents in these settings. They were all residents at either skilled nursing facilities or assisted living facilities. Across all of our correctional facilities, we have 31 cases, 22 amongst staff and 9 amongst inmates. In the shelters, we only have 2 confirmed cases to date, and they're both among staff. We post a list of the facilities with confirmed cases on our website once the sites have notified all of their staff, residents, and families. And as a reminder, with the spread of COVID-19 across the county, we continue to see more cases among staff and residents at institutional settings. For those of you with loved ones at these settings, please understand it's extraordinarily important that there be no visitors at these settings during this time of a pandemic. Our DPH teams are currently working hard at every facility that has a positive case, and we know that management and staff are doing their very best to protect the health of all residents. In many of these facilities, there's large numbers of residents who are appropriately quarantined if they have had an exposure. I'm going to talk for a minute about testing. As of April 5th, we had over 32,000 people tested across the county, and about 14% of folks are positive. We are still struggling to get some negative test results reported to us, so I think that number of 14% is slightly inflated. I want to also note that these are huge improvements. A big shout out to Dr. Kazan and his team for making it possible for residents to get tested. But I want to acknowledge that testing scarcity still exists in some places more than it does in others. And I want to be deeply appreciative of all the supervisors who are working hard to make sure that access to testing does not depend on where you live here in LA County. And as the week goes by, you will see increased capacity that reflects that desire to make sure that getting tested is not a barrier because of where you live or where you work. I still want to note that people who get tested, as Supervisor Barger noted, must be people who are symptomatic and whose clinician has indicated it would be appropriate for them to be tested. For everyone else who's not experiencing symptoms, please have patience. It's not appropriate at this time still for you to get tested. The best you can do for others is to stay home and not expose anybody else or be exposed yourself. I do want to spend a few minutes talking directly to those who are at particular risk for serious illness from COVID-19. And these are people who are older and people who have underlying health conditions. Though lots of different people across all age groups are infected with COVID-19, the majority of deaths have been amongst older adults and people with underlying health conditions. Fully 83% of people who have died from COVID-19 are those who have underlying health conditions, and 76%, that's more than 3 out of 4 people who have died, have been older than 65. It's very important to us that if you're elderly or you have an underlying health condition, you stay home, except to go to medical appointments. When you're out and about, even for essential services, you're putting yourself at risk for becoming infected with COVID-19 and becoming seriously ill. This is especially true as more and more people in LA County are infected and capable of infecting others. Please take advantage as much as possible of delivery services for groceries, medication, and other essential items. We want to encourage grocery stores and pharmacies to offer free delivery services wherever possible to those at higher risk for serious illness from COVID-19. And if you have a friend, or you are a friend, a neighbor or a family member of somebody who's elderly or somebody who has underlying health conditions, please, please help them get their food, their medication, and the essentials that they need so that they can safely stay home. You can leave packages at their doors so that you, again, keep your distance from anybody who may be at higher risk for serious illness. And as a reminder for everyone who's over the age of 65, or if you have serious health conditions, this is of utmost importance right now that you do stay home as much as possible. There is a lot of virus circulating in our community, and you are not safe when you go out and about. So please only go out for those medical appointments that are essential. And if you're feeling mild symptoms and you're a person at higher risk, that is the time to call your healthcare provider. Although we urge others who can stay home with mild symptoms and take care of themselves not to call their healthcare provider unless they have questions or serious concerns. For people with underlying health conditions or who are elderly, we do ask that you touch base with your provider even when you're experiencing mild symptoms. I also want to talk for a minute about face coverings. And we saw a lot of people over this weekend using cloth face coverings while you were out and about. And thank you for taking this additional step to slow the spread of COVID-19. Whenever you're leaving your home to procure or provide essential services, and you're going to be either in a public or a private setting with other people who are not members of your household, we ask that you please wear a clean cloth face covering at all times. You can use a scarf or a bandana, and you can easily make your own. There are many tutorials online that show you how. And you can go to our website at www.publichealth.lacounty.gov for more information about how to wear and appropriately use a cloth face covering. I want to remind folks that your face covering needs to be clean, and you need to clean it each day that you're using it. I also want to note that face coverings do not protect you from the virus. They may be helpful in preventing you from infecting others, but they're not going to keep you from becoming infected. Your best protections remain staying home as much as possible, frequently washing your hands, and importantly, staying at least 6 feet apart from all other people when you're out. And just as a reminder, medical masks, this includes N95s and surgical masks, are for healthcare workers and other essential workers who take care of or are in contact with people who may be or are sick. They are not for the general public except for people who are ill and are asked by a provider to wear one. Please, please do not use N95s and surgical masks if you're a member of the general public. It's appropriate for you to have a cloth face covering, but it's not appropriate to use N95s and surgical masks when they are desperately needed to keep our healthcare workers and other essential workers safe. And face coverings are not a replacement for the powerful tools of staying home and isolation and quarantine when appropriate and when there's been an exposure. Over the weekend, I know you saw, just like I did, many reports that the United States is about to see the worst we've seen so far. And as I mentioned, this may be true in our county as well, where we will see many more cases over the next few weeks. But it remains important that we continue to do what we know will work. And I asked you to do all that you've been doing and can continue to do to play your part. If you have enough supplies in your home, this would be the week to skip shopping altogether. If you can arrange for pharmacies and medications and groceries to be delivered, this would be the week to put that in place. I'm grateful to everyone in the LA community for doing all they can do to slow the spread. And even in the face of increasing numbers and sometimes frightening news reports, you have shown your true spirit by being part of all of the efforts to slow the spread. And a special thanks and deep appreciation to the thousands of frontline workers, our home health aides, clerks, public safety and first responders, public health and healthcare workers, trade workers, and child care providers. We all owe you a debt of gratitude for your service. Keep hope that by working together, we'll get to the other side of this. Thank you, and now I want to introduce Dr. Christine.